Hi, my name is Naba, and today I'll be presenting on how acceptance and commitment therapy, or ACT, can be used to treat complex PTSD. I'll be sharing an overview of ACT, connecting it to a case study, and highlighting recent research that supports its use for trauma survivors. Let's begin with an introduction to the topic of C-PTSD and ACT. Trauma has a way of reshaping a person's life long after the danger is gone. For survivors of complex PTSD or CPTSD, the pain isn't from one single event. It's from years of ongoing trauma, often that the victim has lived through. Traditional treatments sometimes fall short for these survivors because they don't address the deeper wounds to identity and emotional regulation that are unique to these victims. That's where ACT comes in. It offers a different way to heal by focusing on acceptance, mindfulness, and living in line with personal values. But what is complex PTSD? More in depth, complex PTSD differs from traditional PTSD because it's rooted in repeated, prolonged trauma, and it often starts in childhood. Survivors struggle with not just fear and flashbacks like with PTSD, but with intense emotional swings that can sometimes resemble bipolar disorder or borderline personality disorder, a damaged sense of self, and serious difficulties trusting others or forming relationships. It's a disorder that touches every part of a person's life and not just their memories. Traditional treatments have limitations in how well they can support CPTSD clients. Many trauma therapies, especially the exposure-based ones, focus heavily on reducing symptoms like fear or anxiety. But for CPTSD survivors, that just isn't enough. They often leave therapy feeling invalidated because um, their emotions and their experience feels so much bigger than their therapist seems to understand or is providing them the skills to cope with. Or worse, believing that they're broken because they still struggle emotionally even after treatment. They may have tried several different approaches and um, without a proper diagnosis of CPTSD and then accurate trauma informed care, they may not make the progress that they're seeking to. They need approaches that address their full humanity and not just their symptoms. So, what is ACT? Acceptance and Commitment Therapy, or ACT, was developed in the 1980s as part of the third wave of CBT, or cognitive behavioral therapies. In ACT, instead of trying to quote unquote fix painful thoughts and emotions, um, it teaches clients to accept them and carry them, stay present, and live according to their own personal values. The goal isn't to eliminate the pain, it's to change how people respond to the pain so they can still build rich and meaningful lives. How exactly does ACT fit CPTSD? Why is it a good form of treatment for people with CPTSD? Well, ACT is a perfect fit for CPTSD survivors because it offers compassion, flexibility, and importantly, respect for their experiences. It doesn't expect them to erase what happened to them. Instead, it helps them reconnect with what matters most to them and empowers them to move forward with strength and purpose. To bring this to life, I want to introduce you to Emily. Um, Her story mirrors many real survivors, but she's a fictional client from our case study. Emily is a 34-year-old graphic designer who grew up facing emotional abuse, bullying, and social isolation. Despite finding brief success, especially in her career, She struggles with flashbacks, overwhelming shame, and distrust in relationships. Like many survivors, she's been stuck between wanting to heal and feeling like real recovery is impossible. How can acceptance and commitment therapy help Emily to heal from what she's been through? There are certain key processes that are part of ACT that are a great fit for her and her unique needs. First, acceptance. Emily would learn to sit with painful emotions like shame, fear, and grief that she still may be carrying with her without automatically trying to numb them or push them away as may seem natural. Instead of viewing these feelings as signs of failure, she'd learn to see them as natural and understandable responses to what she's been through. Acceptance would help her stop fighting her own internal world and start making space for healing. Um, Second, cognitive diffusion. Emily struggles with self-critical thoughts like I'm broken and I'm unlovable. Through cognitive diffusion, she'd practice stepping back from these thoughts and recognizing them simply as mental events that are occurring rather than absolute truths. For example, she might practice reframing and saying, I'm having the thought that I'm broken, instead of believing it completely and thinking I'm broken. Over time, this would weaken the power that those old narratives have had over her choices. Third, contact with the present moment. Because Emily experiences flashbacks and dissociation, staying grounded is incredibly helpful and important. Acceptance and commitment therapy could teach her mindfulness skills that anchor her in the here and now, like focusing on her breath or engaging her senses, which is regularly or frequently called grounding. By reconnecting with her present environment, Emily would be able to reduce dissociation and regain a sense of safety in her own body as her circumstances in life change. Fourth, self as context. One of the most devastating impacts of complex PTSD on survivors is how they come to define themselves by their pain. Emily sees herself as her trauma and what she's been through. ACT would help her realize that while she has definitely experienced suffering, she is not limited to or defined by it. She's the observer of her experiences and not the experiences themselves. This shift could allow her to start building a new, more compassionate sense of self. Fifth, values clarification. In ACT, Emily would spend time identifying what truly matters to her. Not what trauma taught her to believe about herself, but what she genuinely values. When you're living life in survival mode, it can be hard to take a second and think about what really matters to you and what would make you happiest because you're just trying to get by. Emily grew up turning to art for comfort and self-expression. And so for her, reconnecting with her passion for art and creativity would become a powerful guide. She could reconnect with that joy and make associations that are separate from survival and trauma. Clarifying her values would help her remember that there's still beauty, meaning, and purpose available to her in her life. And finally, committed action. Once Emily has established a clear sense of her personal values, ACT could support her in taking small but meaningful steps aligned with them, with the help of her therapist. Maybe that looks like starting a personal art project rather than doing art for school or for work, reaching out to a supportive friend, or practicing mindfulness daily if she can. Even when difficult emotions come up, she will learn to act in ways that move her closer to the life that she wants to live, instead of letting fear and shame dictate her path in life. So this is some research support for ACT. That should say research at the top. I apologize. So Banks and colleagues. These are sources that I used in my paper. So Banks and colleagues found that mindfulness practices, which are central to acceptance and commitment therapy, reduce avoidance behaviors in PTSD survivors. McLean and Follett in 2016 emphasized that acceptance commitment therapy's non pathologizing stance is crucial for survivors because it's validating rather than dismissing their pain. And we're definitely going to tie back into this concept of non pathologizing. It's hard for me to say that, but it's definitely one of ACT's greatest strengths. Roche in 2020, Roche's case study found ACT effective even for a client that had gone through a traumatic injury. And finally, a 2024 study by Ackerbaum and colleagues showed that internet-based ACT helped clients with PTSD and chronic pain make major gains in their recovery. Tying back into that concept of non-pathologizing, let's discuss the broader importance of a non-pathologizing approach. Like I said, one of ACT's greatest strengths is this approach. It means that it doesn't treat survivors as broken or disordered. Instead, it offers a different approach that sees trauma responses like fear, avoidance, numbness, not as signs of illness necessarily, but rather natural and understandable reactions to trauma and overwhelming experiences. For survivors like Emily, this shift would be crucial. Therapy becomes about honoring the strength it took to survive and not about fixing a defect, which is very validating and can feel very empowering. It helps survivors reclaim a sense of dignity by validating their pain and empowering them to move forward. It teaches them that they're not defined by their trauma. They're capable of building rich, meaningful lives, even with their histories. In the end, ACT offers hope that goes beyond simply symptom management. It offers survivors a way to carry their pain differently. It offers them a way to live fully and purposefully, even with the scars that they carry. Healing doesn't mean erasing the past with acceptance and commitment therapy. It means choosing purposefully to build a life that feels true and worth living. For survivors like Emily and so many others, acceptance and commitment therapy can open a door to not just surviving and trying to stay alive, but to thriving in your life. These are the main sources I drew from for this presentation, and it includes recent research on ACT's application to trauma treatment. Thank you.